Let's talk about IVF success and failures. I'm Dr. Sharon Moyeri, owner and founder of OC Fertility. This is a tough topic because obviously you go through so much with IVF and everyone expects to succeed, but no doctor has 100% success rates, and so it's really hard when you don't have a successful pregnancy, both obviously for the patient but also for us doctors to try to understand and explain that to patients. Sometimes there can be explanations for why it doesn't work, but even in perfect situations, where the embryo is a high grade, where it's been tested and chromosomally found to be normal, and we don't know any uterine factors or maternal factors. One thing I always tell my patients is you don't want to give up because you're likely to succeed over time, and we know that from a lot of studies. So what are some of the things you want to think about? Well, first of all, you want to consider when you're going through IVF and how old are you when you're starting your treatment. Age is a huge predictor of your success with in vitro, and it also predicts the number of cycles you might need to achieve your goals. So setting realistic expectations is really important, but you also can't win a game you don't play. So you also want to think about if this is something you really want, if having a biological child is important, you kind of have to set the expectation that you're probably going to have to put some effort into it, and it's not going to be easy, but recognizing where you're at in your reproductive lifespan is going to set the expectation as to how many treatments you might need to achieve your goals, and then also how many kids you want to have and whether or not it's important to have those children biologically or if you're open to other alternatives. IVF is demanding and time-consuming and expensive, and it can be very challenging to get through the process. It's important that you talk to your doctor and express your concerns and have your questions answered, because there's a lot that goes into determining the success and failure of an IVF cycle. Age is a big component, but also prior history is very important, whether the couple have been pregnant before, whether there's been pregnancy losses, what the hormone levels look like, and all this goes into making clinical decisions about a couple's or a woman's prognosis and the likelihood of success. Oftentimes when failures happen, the first instinct is to think, what did I do wrong? Did I do something wrong? Why did this happen? And again, there's often not a reason for this, and you shouldn't be blaming yourself. Oftentimes these things are unexplainable. You do want to look back and see if there's anything you can learn and anything you can change moving forward. And of course, hindsight's 20/20, but these are important lessons to look back on and gain knowledge moving forward so that you can make some new decisions. So family building is kind of the opposite of family planning. Family planning is contraceptive options to prevent pregnancy. Family building is thinking ahead and being proactive about how you can create your family moving forward, especially if you're starting a little bit later. So it might enable you to freeze eggs or freeze embryos, knowing that if you're starting later and you want multiple children, you might need to think ahead. So if you are 35 and older, maybe don't wait 6 months to 12 months because you might want to bank eggs or embryos.